Thanks for inviting me to speak on the outcomes of the younger patients treated with Tisagenlecleucel. And it's important that to identify these outcomes, because on the ELIANA study, which was a pivotal study for the use of Tisagenlecleucel, they excluded patients aged under 3 with BALL. So to date, the outcomes of these patients aren't known. These are often patients with multiple relapses of infant ALL, a disease entity which is known to have historically very poor outcomes with standard chemotherapeutic approaches, and even in the context of stem cell transplantation. So they represent an area of unmet clinical need, and therefore their outcomes are very important to identify. So through the IBFM Resistant Diseases Committee, we identified centres that had been able to proceed to give this treatment to children aged under 3 at screening. And we asked them to submit data on a retrospective basis using a standardised data collection form in order to identify the outcomes. So this is very important because what we know is that some centres in Europe don't have access to Tisagen for patients aged under 3. And so the ability to define these outcomes might be of importance in improving access for this very important patient group. And what we found as a result of our analysis was that there was a good feasibility of manufacturing. Traditionally, there's been some concern that you may not be able to manufacture a product from a patient who's in an infant age range. But in fact, we demonstrated that there was only a 7% manufacturing failure rate, and only 1 out of 30 patients that we collected data on progressed through the early phase of treatment and was not able to go on to receive a CAR T-cell product. So in terms of the outcomes then, and compared to the patients in the ELIANA study who were aged above 3 years, we documented a very similar complete response with incomplete hematological recovery at day 28. And we had an MRD negative rate of 92% versus 77% on the ELIANA study. And indeed, our event-free survival and our overall survival outcome data were very similar to patients of an older age range receiving treatment on the ELIANA study. So for example, the 6-month event-free survival was 67 versus 73%, and the 12-month event-free survival was 58 compared to 50% on the ELIANA study. And the overall survival data are also very closely matched, both at 6 and 12 months. We also documented that the toxicity profile was very favourable for the delivery of Tisagen to this age range. If anything, mirroring the real-world data in the older age group, we identified that there was overall a reduced rate of severe cytokine release syndrome. Although we use a slightly different grading system for the documentation of cytokine release syndrome, we were able to corroborate that there was a reduced rate of severe CRS by looking at other measures such as median duration of CRS and the median duration of ICU stay and the frequency of tocilizumab therapy. We also documented a reduced rate of severe neurotoxicity as well. So overall, this is a therapy which is feasible to deliver to the younger child. The outcomes in terms of disease response are very similar, and the longer term outcome data are very similar, although the median follow-up is reasonably short and longer follow-up would be required. And so this provides a very important platform potentially, particularly with longer follow-up, to considering whether this approach can be supported through increased access for these younger children to Tisagenlecleucel.